Please, the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Good morning.
Welcome to the Shawnee County Board of County Commissioners. It's August 27th, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. What is first?
First items, item 1, proclamations, presentations. Number 1, contact tracing, biodefense network.
Good morning, Commissioners. Linda Oakes from the Health Department. This morning I'm going to give you a presentation about contact tracing, and I have on the phone with me Harlan Dolgen and John Anthony from the Biodefense Network. So I will start, and then they will talk a little bit, and then you can ask any of us any questions you might have. So to begin with, I just wanted to go over what is contact tracing and why do we do it. So really, I never heard of that term contact tracing until all this started. We always call it disease investigation in our world. And we've been doing disease investigation forever, a very, very long time. It's very common for us to do disease investigation for tuberculosis. If we would ever have a measles case, I'm going to knock on wood, because that's not what we need right now. But any of those diseases, we would normally do a disease investigation, which does include contact tracing. So when we do this investigation, we call you, it's all done on the phone, and we say, who were you in close contact with less than 6 feet for 10 minutes or more, and it could be anywhere, home, work, social, church, wherever you have been. It is important, and I'll show some diagrams here in a minute, why that information is so important in order to stop the spread of the virus and hopefully get rid of some of the restrictions that we're having to live under because of COVID-19. If you are a close contact to a positive case of coronavirus, you are legally ordered by the health officer to quarantine for 14 days from the date of the last exposure. And so we want you to stay home, stay out of the public, and again, here in a second, I'll show you why. So the disease, the investigation process, it entails we or the lab or the hospital that tested you call you and say your test is positive. We say you'll get a call from a disease investigator who will ask you a lot of questions. We have a form we go through and fill out with you, and it's questions. Not only do we ask where have you been the last 14 days and who you could have exposed, we ask some of your underlying health conditions. We ask about your symptoms. That gives us a good base of knowledge about the disease. This is a new disease, and so it's very important that we learn as much as we can about the disease. We also make sure you have everything you need to stay home. We talk to you about what to do if you get more ill, who to contact, and who to contact for questions. And then we do have people, mostly volunteers right now, who call our folks in, we call it isolation, those people with that are positive for the virus. We call every 2 or 3 days just to check in on you, make sure you're doing okay, see if you have questions, see if you have any needs. And if you do, we can take care of those. So that is the quick version of what we do. It takes about 60 to 90 minutes to do a call. So when we get a new case so we're notified from the Kansas Department of Health and Environment, we get a notification, you have a new case in Shawnee County. So we then send that information to our case investigators, either biodefense, we have some volunteers that still do this work, and also the Kansas Department of Health and Environment does some of the investigations. And we send them the information, they do the interview, they get the close contacts, and they complete that timeline. So we look at the last 14 days, where have you been, because that's the incubation period that you could have contracted the virus. We want to try to figure out where people are catching it. And right now, with so many cases and the virus pretty spread, it's getting more and more difficult. In the beginning, we could pretty much pinpoint where folks were contracting the virus. Now it's a lot harder. So this is why it's so important. So this is a diagram. You've got day 0, you're exposed. So that's the first day. And then you're infectious, really, from the time you become symptomatic. 2 days before that, you are infectious, and then ongoing. So you can see day 5, you become symptomatic, but day 3 is when you really became infectious. So you're spreading the disease before you even know you had it. And that, again, makes it pretty difficult. And so on day 4, you've infected someone else, you didn't know it, and they don't know it yet. So again, that is why we have the mask mandates and the social distancing, to try to cut that down. So if we just isolate people that are symptomatic, again, we only isolate them by the time the little house up there in the first row, that's the time we're saying stay home. And so again, they've already exposed someone. That person they've exposed, they've also exposed someone too, and they didn't know it. So you can see it just goes on and on and on. People keep exposing each other, and then they end up with the virus. So if we, however, know who your close contacts are and the date they were exposed, we can have them stay home, and that stops the transmission. So that's why quarantine is so important. And quarantine is tough because you're not sick, so you're stuck at home, you can't go anywhere, you shouldn't have your friends over. Hopefully you're watching a lot of TV and resting, because that's what you need to do. So it's very difficult, and a lot of people are having a hard time doing it, but that's what we need to stop the transmission. We need those close contacts to stay home, because you can imagine if that person then contracts the virus, they haven't exposed anyone. So they finish their time, and then we've stopped that chain of transmission. So very difficult in a household, but it can be done. So that is why it is so important that we do contact tracing. This is the chart that was out this week with our update. This is the confirmed cases with no known source of infection by the week. And you can see the most latest week, it's at 49%. That can change a little bit because we're still doing some data entry and getting some cases back, but it's been running in the 40% for quite a while. That is why we're seeing so many cases, that we can't pinpoint where people got the virus. And that's why it's so important that we try to do that. So why did we go with a contracted company? Well, this work is very labor intensive. We started out with our nurses, as you remember, doing this work, and we pulled nurses from other programs, but that did take away from the work they were doing. We didn't want to hire a lot of permanent staff. We have hired some new permanent staff, but we always do that very carefully because we don't want people to lose their jobs in a year or two. So we didn't really want to go there with the number of people we needed, and we wanted to gear up quickly so we could get going and get our nurses off weekends and back to their regular jobs. And I'm happy to report that all the nurses from MCH and WIC are back in those programs doing that work. They're no longer doing this contact tracing. We're keeping them trained and keeping them around with this work just in case, but I'm optimistic that they're going to be able to stay in their regular jobs now. So we decided to go with the Biodefense Network Company. We were on a pretty tight schedule to get this done, and the folks that work in emergency management in the public health realm knew about Biodefense Network because of their work with closed pods and pandemic response planning. So that is why we chose to talk to them first. They were willing to give it a try, and they've done a great job. And they were interested in getting this area. No one was doing this yet. I mean, it was all new. And so this was really kind of a risk, but I think it's been a good risk. It's paid off. So I'm going to ask Harlan and John now to talk to you for a few minutes there on the phone. So, gentlemen.
Yeah, thank you very much, Linda, for that introduction. My name is Harlan Dolgen. I am a co-owner of Biodefense Network. We've also got John Anthony. He's going to take a majority of the slides. And we'll talk to you about contact tracing and what we're doing. And I'm going to talk specifically about the origins of Biodefense Network. So if you could go to that slide, Linda. So first of all, we started out as a nonprofit. It was pandemicprep.org, which was established in 2006. If you recall, there was a lot of discussion about a pandemic back then. We thought it might be H5N1, the avian influenza or bird flu. And so there was a few of us that thought, three people specifically, that thought that we needed to have an organization that help the whole community plan for a pandemic. There were free quarterly conferences up until 2017. Ironically, it kind of lost steam in 2017, and here we are today in the middle of a severe pandemic. St. Louis County in 2011 hired pandemicprep.org to do some bioterrorism work, and that created Biodefense Network. And we've been Biodefense Network doing pandemic-related and bioterrorism preparedness-related planning since then. And so that really has just grown into this relationship with Linda. The next slide, please. We are coast to coast. It's just a couple of us. So we added John as a project manager. Before that, it was just Dave Reddick and myself for the most part. And we've helped more than 40 communities across the nation, including the closest to you, or City of Independence in Jackson County, Missouri, that we had worked for a couple of years ago. Next slide. And for the next slide, we're going to go to John Anthony. John, why don't you introduce yourself?
Yeah, good morning. I'm John Anthony. Like Harlan said, the project manager for this. I manage the day-to-day operations of the contact tracers, sending cases out that are sent to me each morning and afternoon, and tracking them, make sure they're done on time and properly, and then looking them over before I send them back to county for them to key into the CDC database. The folks that we've hired have a stringent list of things that they have to meet. You can see the list of standards there on that slide. If you're on that slide, I can't see it. But the John Hopkins, I'm not going to read them all, but you'll see that there's a list of courses that they have to take. And also the folks that we hire, next slide, please, they're all medically minded folks. So we have 2 doctors, we have nurses, MPH students, pre-med students, I'm the laboratory scientist in the bunch, and then we have some undergrads. But all of these folks are medically minded folks that they can speak intelligently about the subject matter that they're discussing with the cases that they're calling. So we thought that was very important when we started, that we wouldn't take anybody. We had to somebody with a medical focus in their background or in their studies. Next slide, please. And so the number of cases that we've contacted so far, we began back in June 22nd. It was just myself and Dave and Harlan and another associate of ours, Deb Artman. She's a nursing professor at St. Louis University. We took the initial cases to make sure that we had our process down before we had other folks start taking the cases. So as of yesterday, we had 1,000 cases. So we're above that now, and our case completion rate is 90%, which is pretty fantastic compared to other jurisdictions. That 10%, they just don't pick up the phone, or their voicemail is not set up, and if we can't talk to them, we can't complete the investigation. But so 1,000 cases as of yesterday with a very good completion rate. And the turnaround time that we strive for is same day. That's not always possible, again, if people don't answer their phones. But the turnaround time is the time from when Carrie or Diana send me the cases in the morning to the time that we return them. And about 60 to 70% of the cases we get done same day. So we're pretty proud of that number and the turnaround time date. And lastly, the advantages to Shawnee County, like Linda said, some of the nurses, like they're doing the core public health things like women, infant, children, and I didn't catch the other one, Linda, but maybe environmental nurses. But these people that were pulled from their jobs to do pandemic-related things, when the core public health functions, they don't go away, and so we were able to take that burden off of them, and the rate is very reasonable. It's $20 an hour. You're not going to find a nurse for $20 an hour that's going to work for no benefits and no overtime. And we cover all the training and everything. And the county gets to set the maximum costs on this. So if Linda says you can only bill so many hours per month. That's all we do. And so I think it's been a win-win situation for both the county and for Biodefense Network, and we've had a good time doing it. And I gotta say, just before I close, working with the county, but working with the public there, I think the completion rate is so high because the folks in Shawnee County are just nice people. You know, you get them on the phone and they're easy to talk to. They're very understanding. They get the whole idea of it. And so that's another reason why I think the case rate is so successful there. I don't think we would be getting that in St. Louis, to be quite honest, but we do in Shawnee County. So I think at this point, we'll take any questions that you might have.
So we would all stand for questions at this point?
Okay, I have a question. When you have an active case and you get their close personal contact list, can you test those people that have been in contact with that person, say in a week, to determine if they have it or not, so then they could go on with their life rather than sit at home for 2 weeks? Or
We don't normally test close contacts unless they become symptomatic, and there's a couple reasons. The main reason is even if you test negative in 7 days, you could still become positive in the next 7 days. That's why that 14-day period. There's a lot of people that misunderstand that, and they say, well, I've been in quarantine for 5 days and I had a negative test, so now I can go, right? No, because you could still test positive 3 days later. So you must serve that whole 14 days. So it really hasn't been cost effective or, worth it for now for us to test everyone. We hope we can someday. There is an exception though. When there's several cases in a business or a facility, then we do test everybody to see how widespread the virus is in that facility. So the nursing homes, we've had a couple of businesses that we've tested everybody just to see if we have transmission within that facility or that business. Because usually if you have 2 or 3 cases, you've got more and you just don't know about them. So that is what we do.
in our nursing homes, we've had quite a few cases here. How many of those people, is there a percentage that were hospitalized, or do you know?
I don't know the answer to that.
I had heard that many of them didn't even know they had it, but we have no numbers as to.
I don't know the exact numbers of the asymptomatic, which is what you're referring to, versus the people that are symptomatic, but we have to remember that asymptomatic people can still spread it to other people, and those people may get very, very ill. So
It'd just be interesting to know how many people within the nursing home are asymptomatic, what percentage of them already have.
we can probably find that out.
That would be good to know.
Yeah, and remember, a lot of the nursing home are staff too, as well as residents.
Absolutely. Yeah.
Mm-hmm.
Yeah.
Mr. Chairman. Thank you. I'm going to go through this is Commissioner Kevin Cook. Just a couple of questions for you, Harlan or John. How many employees, you say you go coast to coast, but how large is your company when you're considering this time that we're in right now?
So I'll go ahead and answer that. This is Harlan. So before contact tracing started, before the pandemic started, it was really just 2 of us, Dave and I, and we're consultants. I actually have a full-time job outside of Biodefense Network. Dave is full-time with Biodefense Network. And he would have been here, but he had a conflict today, a session he was leading, so he couldn't attend. So before contact tracing, it was 2 of us. When we started to do the contact tracing, we talked to John, who was very happy to participate. And by the way, John used to work for St. Louis County. He was their emergency preparedness manager for a number of years before this. So, and then we also talked to Deb Artman, who from St. Louis University, a professor there, as John had mentioned. So it started very small, and it grew, and we're now at about 16 people, of which 13 are part-time, and John, Dave, and I, well, I'm part-time as well. John and Dave are full-time participants. So we're a very small company, which means we're nimble. We're able to move quickly on something like this.
Okay. And then The time to investigate, I know the reason why we engaged in contact tracing with Biodefense Network was the time that it took for our employees to do the investigation. Are you finding that it takes a similar amount of time, or were you able to find ways to do it more efficiently with your, as a company, specializing in that?
I wouldn't say we do it more efficiently. I don't know, John, you may have I know it takes roughly 1.3 hours because we track how many hours we bill and how many cases we have. So it's about 1.3 hours per case. And that includes a rigorous quality assurance process that John goes through to make sure that the information is all complete and good from these contact tracers. So sometimes something's caught where it has to go back to the person and then come back to John before he approves it to go forward to the county. So about 1.3 hours, which fits into that 60 to 90 minute window. That's an average.
Okay.
On the lower end of that scale.
You talked about the percentage that you have a completion rate on and that being very high. If a person refuses to cooperate with you and you call them and they say, I just don't want to participate, this is me, I understand that I have an order to quarantine, but I don't really want to share my information with you. Is that counted as a completion, or is that counted as a incomplete?
That's considered incomplete, and that has gone up actually because I don't know if you guys are familiar with that new Kansas law that at the beginning of the interview we have to say, this isn't a requirement, it's not a law that you have to participate in this, and so up front we're giving them an out, and so since then our numbers have declined. But yeah, if they don't participate, we don't consider that a completion.
I know that as we
the completion rate. Oh. Go ahead. I was just going to say the completion rate started out at 93% and has gone down because of that law that was passed, but it's still a high rate.
Contact tracing is a new thing for many of us. It's not something that pandemics are a new thing for all of us. But as we are going through this, are you finding that there are more people that are concerned with what is going to happen to their information? Is their information going to be sold or shared with a pharmaceutical company or Google or Amazon? Are they now going to start getting advertisements for PPE? What happens to their information?
Well, we keep everything on the Shawnee County network. So when I get the cases in the morning, I get them via Shawnee County email, and we all have Shawnee County email addresses. And so I get them, I give them out to our employees who are also on Shawnee County email. They work the cases on the phone, they type in the information and everything stays on the county server. So there's no external, there's no way for any other, as long as the Shawnee County server is secure, there's no way that information is going anywhere other than Shawnee County.
And absolutely, this is all under HIPAA, so we follow all those privacy rules and regulations that follow under HIPAA, as we always have. I do want to say, too, that if you refuse the interview, that's fine. That is your right to do that. You are still legally in isolation, however, and we do deliver those orders by law enforcement when we can't talk to people, because that's the only way we can get it to them.
But Biodefense Network does not keep their own data that they would then be sharing with a third-party vendor?
No.
Not at all.
No,
Absolutely not.
No way.
No, they signed a business associate agreement. All that is locked in.
So, and then, Linda, this is a question I think probably more for you.
Okay.
If you have a person who refuses to isolate, you contact them and you say, it's come to our attention, you've been in contact with somebody who's tested positive, we're giving you an order to quarantine for 14 days and isolate yourself. What happens if they refuse?
We've had some people kind of start to refuse, and we send law enforcement out to have a chat with them. That usually takes care of it. If it didn't, then I would call Jim. and get some advice from him on what to do next.
I mean, I think that that has been an issue in the past where there have been people who have been exposed who continue to go to work or continue to expose other people potentially to the virus, or if they've tested positive, continuing to work even though they know that they're positive because they have this sense that they have to work.
Yes, we've dealt with that. We've talked to employers. We've tried to help with that. I really do appeal to people's sense of moral duty here. You do not want to give this virus to someone who could die from it, and that is possible. So I think most people have been great and cooperative. It's just that few that we tend to hear about.
Overall, I mean, Linda or Harlan or John, I'm not sure who would be best suited. As we do the contact tracing, is it primarily just to get the information on who you've had contact with, or is there other information we're trying to get, such as patterns or practices or how they're feeling or what they're doing? What is the main focus? Is it on just who you've had contact with so that they can filter that out and contact those people, or is it really to get other information about the virus?
I think it's both. It does help us to know what symptoms you're having. Are you asymptomatic? It helps us in the whole nation that we've talked about those rates. It helps us to know what underlying health conditions you have. Like I said, we're still learning about this virus, so it does really help us learn what this virus is like and what it does. And then we can also, when we're interviewing people and they say, well, I have a cough and I have difficulty breathing, that's a clue to us to say, hey, we need to get you some more help. So it's also to support that person who may be more ill than they realize as they start talking about it. We're like, okay, you need to be seen. And Biodefense has run across a couple of those, and they send us back the information with an alert, hey, this person is really having some problems and they need to be called, and then we do.
Okay. And the final question I have, Harlan or John, if we have an individual or individuals in Shawnee County that want to know more about your Biodefense Network, are they able to contact you just to kind of, again, there's a lot of, I guess, they're wanting more information about contact tracing because it's new. Are they able to contact your company and ask just some general questions to learn more about contact tracing? Is that something that they would be able to do?
Generally speaking, any questions are answered on the phone call with them. There are a few times where, first of all, we refer them back to Shawnee County for any additional questions in the future, and that's our agreement with Linda. Biodefense Network, as the name, never comes up with any of these calls. We're here representing Shawnee County. That's who we say we're representing, not with. We're not with Shawnee County, but we're representing Shawnee County. And I don't know, John, have you ever had experience where someone asks more information about contact tracing and is curious about that?
I think one out of hundreds of calls I had called back on and we all use our personal cell phones, which isn't ideal, but called me back a few days later and had some questions, but they were medical questions, and I was happy to answer them. But I spoke with, I think via email, Diana wrote back and said, any follow-up questions, they should be contacting us. And so I sent out that directive to all the contact tracers that, they're not, our folks aren't to be the go-to for follow-up health concerns and stuff. They should always call Shawnee County.
Okay.
Hope that answers your question.
We have provided a phone number, 251-4848, for any follow-up questions, any questions. Those folks also have a list of the names of the contact tracers, so if you wonder if this is truly someone legitimate, you can call that number and get that name verified if you have any concerns. And we've had a few people do that.
Thank you very much.
Commissioner Mays, do you have any questions?
Nope.
One other question. Of the cases that we've had, what percentage of them do we have no idea? They have no idea how they contracted the virus.
Yeah, sure. That would be, and I don't know if I can figure out how to go backwards on this, but yes, we have quite a few people that have no idea where they contracted the virus. So that would be this slide.
Currently, what
so we're at 49% right now.
is that trend going up then?
It's staying around the 40% mark. There's the chart. So we missed the days when it was 15%, honestly.
All right. Thank
Anything
you.
else?
No.
All right, thank you so much.
Linda.
Thank you very much.
Thank you, John and Harlan.
All right, thank you.
Thank you for having us. All right, thanks. Bye-bye.
Bye. All right. What's next on our agenda?
Item 3, consent agenda.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,250,090.92. The highlights out of the voucher report, we have Capers contributions of $343,899.03. Under county project, it was $82,768.76. This is to Shawnee and Company for the renovations to the front of the Shawnee County Courthouse steps. Under elections was $83,315.88. This was many pages of the voucher report that included the board workers and polling places. The board workers alone was $64,476.03, polling places of $3,950. Just again, a kind of a reminder of the cost of running an election for a primary. Under general expense, we had the $175,599.59, which is a 30% down payment for the courthouse elevator modernization. Under holding accounts with the state of Kansas, $168,218.93. And then finally, our health premiums was $179,794.04. I don't have any questions regarding the vouchers. Would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I would move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B, facilities maintenance number 1, discussion and possible approval of bid with Murray and Sons for the renovation of the Shawnee County Commission office at a cost not to exceed $9,030 and authorize expenses not to exceed $2,800 to Falk Architects for preliminary design services, final design drawings, and project oversight for a total of $11,830 utilizing contingency funds.
Good morning, Commissioners. Bill Kroll, Facilities Maintenance Director. I have a short presentation on some things that I think you guys are more aware of than most, but for transparency, let the public know what we're looking for. You added some staff for the commission office, including the PIO, and we needed to come up with some space for them to have a home and an office, and came up with some different thoughts on it. There are some things from Falk Architects here who came in and put some quick sketches together to see what might be our best options. The city of Topeka has weighed in on it. They are going to require building permits and stamp drawings, so our costs are going to go up a little bit because of that, which is included in the memo. First option, we decided against option A, which was taking a little bit of the lobby space and doing some conversion off the back side. Option B is what we've decided upon, which again takes some of the current commission lobby space and comes off the hallway behind that with a door into one office. The existing door that's in the corner in the demo area would remain, and then we would add in a new door to go from the corridor lobby area into the commission corridor area. And option C was one that we were going to just take Commissioner Cook's office and chop it in two, and we decided not to do that. Option D was not really good in space conscious for the folks that we need to come up with some space for. And Falk Architects is working now to finish up final stamp drawings for the city of Topeka, should you decide to go ahead and approve of this expense. The expense right now we're considering to come out of contingency funds, and I'll be happy to answer any questions that you might have. We did get some phone bids because the first bid that we had did come in under the $10,000. The other two did not come in under $10,000. And some of that could be due that we didn't really have stamp drawings that they could really get the detail on that they needed. Murray and Sons did work a little bit with Falk and did some walking through of the site, and I think they're really confident they can get that done for less than $10,000.
Any questions?
Bill, again, just for the sake of transparency, thank you for presentation. I know that you've met with each of the commissioners individually about these plans and looking at the drawings to kind of get a feel for the flavor of the commission or what direction the commission wants to go, and then so being able to get bids. In the option B, which looks at taking the commission lobby and cutting it in half and then allocating for 2 offices that would be off of the I guess, back hallway or second entrance into the commission. Was there concern about the size of the lobby, or if we have people in the chambers and they're trying to leave and if there was a fire or an emergency, is that going to be a concern with people being able to exit? I mean, because right now we have a pretty big lobby, and under this Plan B, our lobby is going to be pretty compact.
That's one of the reasons the city wants to get involved in it, is to make sure that our occupancy loads stay where they need to and that the exiting can be proper. At first glance, what Fran Huggett, the city of Topeka, had responded back in an email was it looked okay, but permits would be required and they would need to see the corner of the building for the proper exiting. She doesn't think it's going to be a problem, but it could be. Falk doesn't think it's an issue because the load in the lobby, where the current desk is sitting there now, you don't get a lot of congregation back where those offices would be. So you wouldn't really have more people in the lobby area unless we had a huge commission overflow, which we're using like Great Overland Station now for more space and for public distancing. And we do have the streaming goes on in the snack bar area too for people to kind of come and go a little bit. So don't anticipate any exiting problems or any load occupancy issues.
I mean, in the past, I mean, there have not been, we have occasionally very large groups, but for the most part, there's not large groups of people that are attending county commission meetings, but there are times where we will have large groups on particular issues or using of overflow down the hallway. Are there concerns with that this is going to create some crowding in that area?
No, our corridors are over 12 feet wide in most places, so the corridor areas, our exiting is very good at that building. So I don't anticipate any issues with that at all. Neither did Falk Architects.
In looking at the 4 options that Falk had drawn up, was the option B the most economical of the 3, or?
They were all about the same because mainly you're kind of adding a wall and punching a hole in a wall for a door on virtually any one of them. This one just took a little bit less space, probably has a little less air conditioning and HVAC work to do. Because one of the things you don't want to do is just start throwing up walls and not have proper airflows, and you have uncomfortable people if you do that. And in this particular option, we won't really even have to mess with the overhead electrical lighting because of the way it's located. We're gonna have light in each office without new switching and new fixtures and everything else. So it's almost like partition type office stuff that you're able to just put in with little or no effect. But in this case, it would be drywall and steel frame.
Under the option B, is there going to be any desks at all in that lobby area, or is it just going to be chairs only?
At this point, the thought would be chairs only.
Okay,
Because
so,
the desk areas would be into the office. As you can see in option B on the right-hand side, we call for a window to be between the receptionist area and the general public. So there would be somebody to greet people as they come in. They wouldn't just see a wall. There would be somebody there to greet them and have them have a seat and either wait to see one of the commissioners or go on into the commission chambers.
under the presentation by Falk, there was a description of them acting as a project manager for an additional sum of $2,000. Do you think this is a good investment, or would you be able to act as the project manager, as the facilities manager?
I'll be able to act as the project manager without any difficulty. What Falk is going to have to do now that the city is requiring the stamp drawings, I mean, he's got an investment, and if he's going to put his stamp on it, he needs to make sure that he's covered. So he did agree to stay at his hourly rate in an email to me before this meeting, and with a fee not to exceed $1,500 for the proper stamp drawings that the city wants, and answering any questions that the city might have, not to exceed $1,500, but going at his hourly rate. So anticipate that actual number being lower than it is in the request.
With all of the additions that we're doing due to COVID, with the additional plexiglass and safety precautions and just overall considerations of how people move around the building, the modernization of the elevators, is this going to be able to be done? Are we going to be able to get this done during a pretty quick timeline?
Should you approve it today, we should be able to get Murray and Sons to start on it sometime in early September, and I would guess we'd have it done no later than the middle of October. There's just not a heck of a lot of construction involved here. It's really just two walls. Probably the number one thing we would wait for would be doors, if we have to order the doors.
And then my kind of last question is, as to the cost, the reason why you went out and did phone bids as opposed to a request for bid or proposals, why do it just by phone bids?
Well, we didn't know what we were going to get into on this. The first few thoughts were we going to do some office partition type furniture? We had a lot of questions. We wanted to do some things that we thought would be economical, and this is definitely more economical than going out for RFP and having 15 people come through on bidding and things. But Betty wants to add some.
Betty Greiner, Director of Administrative Services. Under our purchasing policy, if something is under $10,000, you just do informal bids. You don't go out through the whole RFP process. The expected cost for this was under $10,000, so that's why he just got the phone bids or the informal quotes. Then, since one of them remained, and the one that you wanted to go with remained under the $10,000, then I feel like that is within compliance with the purchasing policy. If you had decided you wanted to go with one of them that was over the $10,000, then we would have had to go back and go through the RFP process. So does that answer your question?
And this does follow the purchasing policy?
It does, yes.
Okay. I think it's just very important. This whole presentation is very important for transparency, even though, it's under $10,000. It may be viewed by many as just kind of a minor project, but this is one of those times where we have three commissioners who can't just sit down and talk to each other in an executive session about what we want to do with our own office. So we do need to have transparency before the public as to anything we're doing. And also, we are the leaders of Shawnee County, and whatever policies we put in place, we should be setting an example for all the rest of the departments that we're following all the rules that we expect them to follow. And so I just want to make sure that we've dotted all our I's and crossed all our T's and followed all our policies.
And, I did contact, reputable companies too. It was KBS and Seni for the other two bids. I think in one case of those two, one of them is so busy, I think they kind of put the price up enough where they wouldn't be selected, just so they could stay concentrated on some other projects that they've got. And that can tend to happen sometimes with contractors, but they want to give you at least a shot of giving you a price. Murray and Sons is reputable. Senni, KBS were the three that I did solicit information from, based upon basically just conceptual drawings, which are really difficult for somebody to give you a hard bid from. So,
I don't have any other questions.
Do you have any questions?
No, I do think it's just for clarification for anyone who's paying attention that what this is we've reclassified 2 employees from other departments to work in the commission office, and we just don't have any room for them, so we're creating 2 new offices, in case that wasn't clear.
yeah, and basically doing it with 2 small walls. The cost of that, you know, if you're trying to remodel your house, you know that costs go up, but just in the years I've been doing this, the amount it costs to do a small project like this is probably quadrupled in probably the last 25 years. It's amazing how much the expenses go up and up and up. You wouldn't think it would be that much.
And I guess the question is, Mr. Chairman and Commissioner Mays, is option B the option that we want to go with for the remodeling of the commission office?
I like option B. It doesn't affect the existing offices. It does chop our lobby in half, but you know, for 99% of the time, that's fine. There are some times when we have commission meetings where people gather there. They could also gather out in the hallway or in the other interior hallways. So I think that's just kind of a minor inconvenience. I don't feel like we need a desk in the lobby where we have the window, so I think it works in. Everybody has their own space where they can kick their door shut and have some privacy to get some work done. So I like option B the best.
I might add that, you know, the total number of seats in the lobby would remain the same, because the way that desk is in there now and the window, we don't really have any chairs in front of that area, so we actually have the same number of seats for people to wait in the lobby that we do currently, even with option B.
I guess I do have one additional question. Bill, right now we've got a large printer in the lobby area. Have we taken that into consideration where that'd be located?
No, but we'll find a home for it.
Okay.
I think we talked about putting that in the back
In that
room,
break area?
in that break area. I think there's plenty of space there. In fact, we have a piece of furniture in there we actually don't even use that could be moved out, make room for the printer.
Okay.
I think that'd be handy anyway, because that's where we keep office supplies and other things. And it's it would give our printer a little more security too, being back there. All right.
All right, I'd move to approve.
I would second. Motion's been made by Commissioner May, second by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B2, consider approval of a request to solicit proposals to select a provider for the disposable paper, plastic, and other consumable items to be for use in all Shawnee County facilities and properties.
Good morning, Commissioners. Bill Kroll, Facilities Maintenance Director again. Our contract with Veritiv Paper Supply is coming to an end. We went into a contract with them following an RFP several years ago, and it's been very beneficial countywide. I don't really have any problems with Veritiv at this point. I don't think any of our different departments do, but it's time to do it again. And who knows, we might get better pricing yet than we're getting from Veritiv. So I'd like to move forward with an RFP and see who wants to sell its consumable items.
Any questions?
No?
I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0.
Thank
Next
you.
item. Thank you, Bill.
Item C, Public Health. Number 1, consider approval of request to fill a vacant emergency preparedness and community outreach specialist position in the Public Health Emergency Preparedness Program at a cost of $65,966, including benefits funded by the Kansas Department of Health and Environment Local Preparedness Grant and any subsequent positions that become vacant from filling this position.
Good morning, Commissioners. Linda Oaks from the Health Department. We have had another resignation in this area, the emergency preparedness area, so we would like to go ahead and find a new person for this position. This position we actually have housed at the Emergency Operations Center. We started that before the pandemic. I'm so glad we did. That has worked out so well because they understand emergency management, so we would probably continue that. I haven't asked Dusty, but I'm sure he'll be okay with that. So we would like to go ahead and fill this position. It is a completely grant-funded position from the Kansas Department of Health and Environment, and I'm happy to answer any questions.
Questions? I would move for approval.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Linda. Next item.
Item D, corrections. Number 1, consider approval of request for fiscal year 2020 fourth quarter budget adjustment report to adult community corrections budget.
Good morning, Commissioners. Tim Phelps, Shawnee County Department of Corrections. This item is a annual, it can be a quarterly activity regarding the grant budgets that we receive from KDOC. And this adjustment was made so that we could adjust our payout fund, which is the retirement fund for the employees at the ISP office, so that it would be properly funded after I discussed that issue with audit finance. And so we had some additional funding at the end of last fiscal year, so I made use of those funds. I'd be happy to answer any other questions you have.
Any questions?
I'll move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item D2, consider authorization and execution of contract C298-2020 with Haley Counseling Services for the Family Peace Initiative for services during state fiscal year 2021 to provide programming for juvenile offenders that addresses the cause of criminogenic behaviors and the tools to address those behaviors at a cost of $16,500.
Good morning again, Commissioners. Tim Phelps, Department of Corrections. This program that we presently have operating in the Juvenile Detention Center, but I want to bring it into the Juvenile Community Corrections operation because it is rapidly becoming recognized as a successful evidence-based program that allows the higher level criminogenic behavior patterns to be addressed with the juveniles. So we have worked with the company and negotiated a pay-as-you-go program that will cost us a maximum of $16,500 in this fiscal year. I don't expect it to reach anywhere near that, but that's the maximum of our exposure, and it's all KDOC funding. I'd be happy to answer any other questions you have.
Could you tell us how this program works?
Well, I can tell you essentially the way it operates is they bring the juveniles into a small group setting. It's all confidential as far as what they reveal, but they address the traumatic events of their history that inform their behavior patterns. They are educated on how that trauma perpetuates and leads to a lifetime of criminal behavior, and then it even leads to, if they have children, it goes through generations. And it has proven to be a highly active or interactive program at juvenile detention, and it has had a dramatic impact on the behaviors of the juveniles while they're in detention. And other jurisdictions have been using this program and have seen impact on the way that same class of juveniles behave in the public. And so we are hopeful that we'll have the same success.
That's great.
It's a great program and it's been well recognized.
I would move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Thank you, Commissioner.
Thank you, Tim.
Item E, solid waste. Number 1, consider approval of request to add 3 cellular phones to the existing Verizon wireless contract to facilitate communications with customers at a cost of $40.01 per device, totaling $1,440.36 annually from the department's operating budget, 100% fee funded and non-taxpayer supported.
Good morning, Commissioners. Bill Sutton, Department of Solid Waste. I have 3 drivers that through the normal course of their business, they have to routinely communicate with their customers to gain access to the commercial or industrial containers. And I have discovered that they've been doing this on their personal cell phones. And as a result, they have been receiving unsolicited phone calls, out of business hours, requesting service for these containers. So we'd like to add these 3 phones to our existing contract at the rate of $40.01 per device with a total amount of $1,440.36 annually, so that we are eliminating our employees from using their personal devices on business. This funding is coming from our operational budget, which is 100% user fee funded and not taxpayer supported. Stand by for your questions, gentlemen.
Questions?
This makes sense. I'll move for approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you,
Commissioner.
Bill. Next item.
Item F, Human Resources. Number 1, consider authorization and execution of contract C299-2020, amendment number 1 to the First Stop Health Agreement for the addition of virtual mental health services at a cost of $1.45 per employee per month from September 1, 2020 until December 31, 2020, to be paid by the coronavirus funds and increasing to $1.75 per employee per month beginning on January 1, 2021, to be paid from the insurance fund.
Good morning, Commissioners. Angela Lewis with Human Resources. I'm sure you're all familiar with the fact that we already used First Stop Health for 24/7 medical services. This would just be the addition of mental health services. It would allow benefit-eligible employees and 7 members of their family to participate in 24/7 mental health services. I think we'd all agree that right now, sometimes you just need someone to talk to, and this would be a professional counselor available to you 24 hours a day. I'd be happy to answer any questions.
I'm just out of curiosity, I mean, if somebody were to use this, are they going to get assigned to a caseworker or a social worker that they get the same person every time they call, or do they have to, that might know the backstory time after time, or, I mean, is this something where if somebody calls, they just get whoever answers the phone, or?
Initially, they're going to get whoever answers the phone is on the end. They won't be assigned to someone. They'd keep that person. Of course, if it was after hours, it could be different the next time, but this is for the emergency that's happening right now in your life that you would get this service, and then they would help you find someone for a regular basis.
Okay, good. All right, thank you.
Okay. Any other questions? No. I would
Move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Angela. Next item.
Item G, Public Works. Number 1, consider authorization and execution of contract C300-2020 with Traffic Control Corporation, allowing for the sole source purchase of a replacement software and controllers for up to 4 Shawnee County traffic signals at a total cost of $16,100, with funding from the Public Works Operational Budget Road Maintenance Fund.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. We have a contract with the City of Topeka in which they maintain all traffic signals in Shawnee County outside the City of Topeka that are not City of Topeka owned or KDOT owned. And as part of that maintenance contract, it's time to upgrade the software and hardware controllers that are the brains of these traffic signals. The existing software and hardware is no longer supported. The city is in the process of updating all of their signals, or they have, and so this hardware and software is consistent with the equipment the city uses. Obviously, that's an advantage because you have consistency in parts, operation, maintenance, etc. So with that, again, let me say, this is a sole source purchase for that reason. And I guess I'll take your questions.
Do you have any questions? Yes.
Just to confirm, we're talking about 3, maybe 4 traffic control devices.
Correct. And I can give you those locations. They were, well, I thought I could. I'm
Page
sorry.
3.
Kurt, here. Kurt, would you like?
Oh. Thank you. The locations that we have identified, or the city identified for us, is Southeast 6th and Croco, Southeast 29th and Croco, and Southeast 45th and Adams. The signal up at 58th and North Topeka Boulevard is really just a glorified school zone crossing signal. And I've initiated communications with the school district to see if that signal can be removed, because there once was an elementary school up there, and I think it has moved south to the elementary and middle school complex. So we won't remove anything that is still in need, but nevertheless, it's something that we need to check on, because obviously the equipment upgrades would be $4,000 and the yearly maintenance fee to the city of Topeka is over $2,000. So if this signal is no longer needed, we would save the county $6,000. So that's what I'm checking into, and that's why I'm telling in the paperwork with the memo that I provided, possibly 58th and North Topeka Boulevard.
Kurt, with the change that's going at 29th and Croco, and with all of the updates to the roadway, is that going to change the scope of the signals that we have there in any way?
If you recall, we have the pedestrian crossing on the east leg of Southeast 29th. That signal has been included. We anticipated the completion of the project, and that signal has been included in our City of Topeka Shawnee County maintenance agreement. Since it's a pedestrian signal, it won't require the level of maintenance from the City of Topeka that a regular traffic signal requires.
Yep. I'll move for approval.
Second.
Motion's been made by Commissioner Cook, second by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you.
Thank you, Commissioners.
Next item.
Item H, elections, number 1. Consider approval of request to offer a candidate the position of election manager, election systems at an hourly rate of $23.02, range 15, step 4, for an annual salary of $67,707.62, including benefits, with funding from the departmental budget.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. Here requesting permission to fill the vacant position of election manager. We found someone who actually works in the department, does great work currently. We think it is a reasonably excellent hire, so we would ask permission to complete that. As a reminder, this is the position in the office that actually builds, prepares, and gets the ballots ready to go, so we do need to make that decision fairly quickly. Happy to answer any questions.
Any questions? I'll move for...
Mr. Chairman,
Oh, yes.
this is to replace, there was a long-term employee that you had that recently retired, and this is filling that position.
That is correct. It's filling a recent retirement.
And they're going to be able to come up to speed and be ready for the upcoming election in November.
Yes.
Okay. That's good.
I will move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Thanks.
Item I, Parks and Recreation, number 1, consider authorization and execution of the following agreements for the Mighty Shunganunga Open Disc Golf Tournament to be held on September 20th, 2020 at Crestview Park. Number 1, contract C301-2020 with Dawn to Dusk Disc Club to rent the Crestview Shelter on September 20, 2020 for $50. And B, resolution number 2020-50, temporarily exempting Crestview Shelter House shelter on September 2020 from 11 a.m. to 7 p.m. from restrictions on selling, serving, possessing, or consuming alcoholic liquor and or cereal malt beverages.
Good morning, Commissioners. Randy Luby, Parks and Recreation. This is an independent contractor agreement with Dawn to Dusk Disc Club for their annual tournament that they put on out at Crestview. The only thing different in years past is that they will be selling alcohol after the event at Crestview Community, or not, yeah, the Shelter House, not the Community Center, the Shelter House. Basically, this resolution gives them a temporary permit to do that on the day of September 20th. I'll be glad to answer any questions you may have.
Any questions?
No, just so you know, Shunganunga, I believe, is one word.
It probably is.
And it has exhibited its might a lot lately.
Yeah. All right, I would move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0.
Thank you,
Randy.
Commissioner.
Next item.
Item 5, Administrative Communications.
Okay. Anybody who has any announcements, public or department heads, whatever? Nope.
Good morning, Commissioners. Stephanie Kuhlman with the County Commission Office. Okay. Shawnee County employees can help United Way of Greater Topeka live united. Topeka's United Way focuses on education, income, and health of anyone living in Topeka and Shawnee County. Our upcoming fundraisers help our community in many ways. For example, the Shawnee County United Way Coalition focuses on increasing the number of students who read proficiently by the end of 3rd grade. This campaign was recently recognized with their 5th National Pace Setter Award. Shawnee County was the only community to receive Pace Setter honors this year in Kansas. This is proof your donations stay in Topeka and the neighboring communities. This Tuesday, September 1st, our fundraising events begin. And to get things started, Human Resources will be selling biscuits and gravy at 7:30 that morning in the courthouse basement. And starting now, you can purchase a mask with the county logo. They are $8 each and available through November 1st. All orders and payments are done online with the local printing company called Go Blue Printing. I will send out an email tomorrow with this link on the flyer. However, if your emails get deleted, you can go to goblueks.com or you can Google Go Blue Printing Topeka. You will click on the Go Blue stores. That will take you to this page. Scroll to the bottom and click on the Shawnee County face masks. Scroll down to see the styles and colors that are available. Later on in September, we will have donuts in the courthouse and a golf tournament on Friday, October 9th. You can start forming your teams now and get registered before it's too late. We have events already scheduled for September and October, and I'm sure there will be more to come. Now for an even bigger event. The Greater Topeka Partnership is hosting the State of the Community featuring Commissioner Rippon today at 3 p.m. He will be presenting his vision for quality of life in Shawnee County. I am so excited to see his presentation on the Jumbotron in Landon Arena and to see these drone videos that Sergeant Coffin in the Sheriff's Office recorded just for this. Make sure to check out the new Shawnee County Facebook page. Probably tomorrow or early next week, I will have the video of his presentation from the live event today. That is all I have.
Thank you, Stephanie.
Thank you.
Got stuck on my earring. Good morning, Betty Griner, Director of Administrative Services. I'm here to talk to you this morning as a member of the Shawnee County Sparks Committee. As you know, the committee, you as the commissioners designated $5.5 million for community-based programs of the coronavirus relief fund that the county received. The community can now start making applications for that money. The applications were sent out to all of the emails that we have received that are interested in that. Any of our community partners that the county has contact information for. There was a press release that went out yesterday that gives a link where any of the public can go out and find that application. It is also on our website that there is a link under COVID-19 financial information. There is a link to that application. We will be receiving those applications. The Shawnee County Sparks Committee is working on the criteria that we will use to evaluate those, but we want the community to go ahead and start sending in those applications now. So, any questions on that?
Questions? Thank you, Betty.
Thank you.
Good morning, Commissioners. Melanie Bergers, Shawnee County Sheriff's Office Communications Division. We'd just like to announce today that we're holding open interviews for communication specialists this Friday from 4 p.m. to 8 p.m. and Saturday 9 a.m. to 2 p.m. We've created and started a new recruiting and hiring initiative that began last month. Each month we're trying something different in our advertising and seeing which is most beneficial to reach as many people as possible. Last month when we did these open interviews, we entertained 12 people. We were able to meet and talk about the job itself, talk about benefits for Shawnee County. The folks that come in on Friday and Saturday this week are able to come down to the sheriff's office, and all they need is a photo ID and preferably a resume. We will allow them to take typing tests at that time. They'll be able to network and communicate with dispatchers that are currently working in the center, supervisors, and our hiring and recruitment supervisor as well. This was very beneficial in the last time we did this. Historically, we've held informational meetings, and this is just another piece to that. After those open interviews, those that were not able to make it, they went online and filled out that application, and we were able to conduct about 30 interviews in the last month. Of that, we have seen 6 people that are completed the hiring process, and a potential for all of those to make it for our next academy, September 14th. The open interviews that we'll be holding this weekend, those will be for an academy starting in October, and then we'll continue this throughout the rest of the year. Since this last year, we have focused on making our hiring process much shorter. We have gone from 4 to 6 months to 2 to 3 months, and in this last, since the beginning of July, we were able to get that all the way down to a month. And with the help of human resources, they've been a big asset in making this process much better. So we just want to invite anybody who is interested in dispatching at the sheriff's office and a 911 center to come down and have a conversation with us, see if this is something that you're interested in, and then we'll work with you through the process to get you in the next academy. Thank you.
Thank you, Melanie.
Just wanted to, Kurt Niehaus, Director of Public Works, just wanted to announce that that mill and inlay job on Wanamaker Road, south of 47th Street, completed last week, 3 days of work. It's been striped by county maintenance forces, so just wanted to let you know on that. Thank you for your assistance on that.
Thank you, Kurt. Anyone else? We have no need for an executive session, so we're adjourned.